The broadcast is now starting. All attendees are in listen-only mode.
Very good afternoon, everyone. Thank you so much for joining in this session. I am Shaista Khan from Ameyo and will be your host for today's webinar. Today, we will be discussing about digital transformation in healthcare, how healthcare industry has been bringing a fundamental shift from volume to value of care. We will be discussing about the challenges faced by patients and healthcare providers, and what are the patient expectations, different ways to enhance the patient experience, and much more. But before we start the webinar, actually, few instruction. Those of you who have any questions, please do keep them ready in the question panel, and we will take them up once the presentations are over. So stay tuned for that. So to take us through this webinar, we have two speakers. We have Murli Krishna from Lead Squared. We have Prince Singh from Ameyo. I would request both the speakers to share a few lines about themselves before they start presenting. Now over to our first speaker, Murli. Hi Murli, thank you so much for joining
Okay.
us. If you could please
Yeah,
share a
thanks,
line
Esther.
about, yeah.
Yeah. So I am Murli and I head sales for Lead Squared, right? So Lead Squared, basically one of the segment which we focus on is healthcare, which we have around 30 plus customers in India in healthcare and a few of them, across the globe. And I come with a vast experience in sales and meeting a lot of healthcare customers. So in this webinar, we will focus on how the journey is happening at present in the healthcare vertical and how digital transformation, as a journey, the way forward for hospitals especially and overall healthcare as a business, right? And we have Prince. I think I'll give it over to you, Prince.
Thank you, Murli. Good afternoon, everyone. This is Prince Singh. I head product management at Ameyo. So a brief about me: I have been, into product development for Ameyo for quite some time. Started with in 2005, and for the past 2.5 years, I am overseeing product management dedicatedly for Ameyo. Shasta, can we go to this next slide, please? Okay, so when we talk about healthcare, and look at some of the statistics that are available with researchers, or even if we look at ourselves from the other end of the spectrum as consumers or as somebody who are seeking healthcare, either as a regular, a proactive or a reactive healthcare. So this is the customer satisfaction survey, which was done by eMarketer in 2013, which says that healthcare ranks one of the lowest in terms of satisfaction, with banking being the best. So it is an indication that healthcare has a lot to offer in terms of patient experience, as well as the healthcare providers making their work smoother as well. So this is a research which was done by Deloitte. So it says that about 10 trillion USD would be a global healthcare expenditure by 2022. And when we look at the breakup of the channels or the interaction methods that the patients prefer today when reaching out to healthcare providers, so as you can see, 29% are limited to phone calls, and we have quite a few dedicated digital channels such as email or online patient portal, mobile app, and text messaging. So this gives an indication where a clear indication that the patients prefer to reach out to healthcare providers through digital channels. This is true for other industries as well, but it is now taking up shape in healthcare as well, in both developed as well as developing emerging markets. So a few areas which are the challenges that healthcare currently sees. So the first is unskilled customer support agents. Healthcare usually needs very specific set of skills for the agents, and they need to understand the business side of the healthcare more than any other domain. When I say business side, it is the enterprise or the hospital or the health tech, understanding the entire domain. For example, understanding the departments or the specializations that a hospital or a healthcare or a health tech organization provides. So they need to understand and be able to distinguish between a neurologist from a urologist, or from a heart specialist to a cardiologist. They need to be able to understand that. So one challenge is that. The other is contact center routing is broken. When we say broken, it is usually distinct. So as an example, we were today reaching out to one of the hospitals close to our office to be able to onboard our organization with them for corporate discounts when our employees visit that hospital. So we reached out to the hospital's primary number, not the emergency number, but the primary number. We asked to give let us speak to somebody in marketing. So the call got transferred. It rang for quite a long time, and then it got transferred back to the reception, and then it was transferred again to another extension. So the entire experience was that we attempted for 10 minutes, and finally we were unable to speak to anybody. I'm pretty sure that the hospital is certainly looking for more business and would love to have us on board, but the entire routing thing was gave us a bad experience, and we gave up. We called up another hospital as well, but we were able to progress there, but with the first one we're still stuck there. So that does happen in a lot of cases, because hospitals traditionally have been PBX or basic intercom infrastructure in place, which is essential. But for a great patient experience, PBX is not sufficient. You need a full-fledged contact center solution to be able to serve that. The third is poor documentation. It is generally the case where a case history or whatever is discussed with the patient is, or whatever the doctor has recorded after conversing with the patient, is not actually put into documentation, or is not properly documented. It's not searchable, or it's not something that can be referred to. It's also called electronic medical record. So one of the big four had a survey and then a research published in 2019, which says that electronic medical record is one of the primary problems to be solved in documentation. With that being absent, the entire experience around healthcare is affected. Another one is unsympathetic response to patients' complaints. So it's again, when you have a contact center agent coming from, let's say, not to derate any other industry, but let's say if a health contact center agent is coming from an experience of serving telecom customers. So let's say if I called that agent and I asked for my data speed is not sufficient, or I'm having some challenge with my mobile network. The same agent, if he moves over to a healthcare provider, most likely when I call him, I would either be looking for a proactive, health checkup, or a regular visit to the doctor or a dentist or something, or maybe a reactive checkup where it could be a basic health issue, or a trauma, or something really very serious. So the patient, the unsympathetic response is one of the challenges that hospitals face, and a lot of times the transaction between healthcare and patients turn ugly for this reason as well. There are other reasons also, but then they go to the wrong direction. The third is incomplete follow-up instructions. What has to be done if this thing happens, then that is something which is not clear. That is also one of the reasons of challenges in healthcare. This is what patients have as an expectation. They need personalized care and alerts. When I visit my dentist or any of the people that I know of, we would prefer to have somebody reminding us of our visit and knowing us that when we visited, and it should not be a blank reminder. As such, it should be a reminder that keeping in mind when did I last visit. That should be there. The person who calls me to remind if it's a call or any other digital engagement should know a little about my history. That is, which is safe to be shared with that person. The healthcare should be guided. It is something that you would generally, if there is a need of healthcare, you would start with visiting a general physician, and then he refers to you another doctor or a specialist or so on. In this entire journey, you are handed off from one doctor to another, but there should be the entire healthcare provider should be overseeing this entire journey of the patient, so that it can be he can be guided on the right approach and progress. Patient education is very important. It should be easy to reach out to healthcare providers. Their availability should be high, and health records should be digitally managed and reachable, so that I do not lose any records that I have taken. So any basic diagnostic checks to very advanced tests to clinical history to probably appointment history should all be available easily to the patient as well as to the healthcare provider. So that is but primarily needed by the patient. So then we have healthcare providers. So they need the primary thing that healthcare providers, while interacting with the patients, they need to be able to interact. One is that with all channels. So be it voice, be it email, be it mobile app, be it chat, social media, if there is an engagement there as well. So they need a unified agent desktop where they're able to interact on the same screen. They're also able to see relevant patient information. They should also be able to see why is this patient reaching out, or why do I need to reach out to this patient, and any other system that might be there in the healthcare domain. So as we understand, there are a lot of different systems which are working in a hospital. There might be an elaborate ERP. Even after that, there are systems that are built on top of it, and the healthcare provider may need to refer to more than one system to be able to serve a patient. The other is security and compliance. It's in favor of patients. It's also needed a mandation by government in most countries and geographies where you need to be compliant with a certain security guidelines. You need to make sure that health records and everything is kept confidential. And the last is reporting, so that the healthcare provider can take data-based, data-oriented decisions. For example, how many people are, using the mobile app to register an appointment and then reaching out over phone to probably change the appointment. So such a data can be used to enhance the mobile app. So okay, let's take this to digital channel itself. So such data should be something that a contact center or the CRM application or any other application should be able to provide. Yeah. So do we have any questions so far? We can progress, I guess. So over to Murli.
Yeah. So thanks for the inputs, Prince. I think those are definitely valuable in terms of patient experience. So as Prince mentioned, right, so basically patient experience is all about getting him information more personalized and and also engaging him at different levels. So Lead Squared and Ameyo together comes as a platform, and we already work in the healthcare industry, right? So Ameyo offers your cloud telephony and related services in the cloud front and the telephony front. And Lead Squared comes as a holistic CRM where it can basically provide a customer one view or a patient one view in this case, which basically helps all the telecallers or the marketing teams or whoever is patient facing in a hospital perspective will have a more detailed view of the patient, which will basically help in terms of giving a seamless experience, right? So we'll quickly go in detail on how the solution together can work in the hospital scenario, right? So I think we can go to the next slide. We have a couple of points Prince will explain, and then I'll take it over from there.
Thank you, Murli. So a few areas where the two systems can actually help, the entire business is, for example, making an appointment or canceling an appointment, being able to, easily see what are the in the appointment system, what are the available slots, who is calling in, identifying the person, the patient, the caller automatically, showing the relevant information, showing the relevant appointments as well with that patient, and then allowing the healthcare agent to be able to change or cancel or book the appointment. The systems can together also work as to help for follow-up calls. So, for example, if one customer or a patient has done a regular health checkup at one of the diagnostic centers, and probably that diagnostic should be done once every year. So this can be recorded in Lead Squared, and it can then trigger an automatic reminder mail, and then probably a call or any appointment. Thank you for reminding, but I would want to seek an appointment with the doctor first. And in both the cases, the patient did need help of either the diagnostic lab or the doctor. And by a proactive reach out by the system itself, we are able to ensure that the hospital is also engaging with the patient at the right time and able to bring him at the right point. So then there can be customer service issues, also billing issues crop up sometimes. There are challenges with bills, there are challenges with payments. Then there are customer service requests, such as patient might just want to reach out to seek a test report, which he feels that is not available on on his app or on his email, which he was expecting. There could be challenges related to insurance as well. So health insurance related, medical insurance related queries might also be there. These might be before medical insurance is used or after medical insurance is utilized. So in all of these, if we actually see, there are usually more than one or two parties involved, not just the agent and patient, but other parties are also sometimes involved, such as diagnostic lab would be involved. And this would be a multi-point reach out. The patient reaching out to the contact center or the other way around, and then the healthcare system reminding the patient of coming to the hospital or the diagnostic lab at the set time. And once he has done that, then reaching out to tell him about the report and probably a follow-up appointment after that. So this entire thing is fairly complicated unless it is automated. Yeah. Can we go to the next slide? So a few areas where we can improve this entire patient experiences. bringing in IVR when patients or healthcare seekers are calling in or reaching out, then bringing in IVR. IVR is just not just limited to voice. One can also develop fairly complex flows in through email systems as well. Primarily, it is voice. Then there might be a need for voice logging, again for compliance or quality purposes. So a system should have IVR as well as voice logging. A few primary things. Workflow is very important. So as an example, a diagnostic lab books an appointment or calls up the patient to remind him of a possible test that he might need. To actually booking that appointment for test, the phlebotomist calling in to remind that he's coming for collection tomorrow morning and you should be on a fast. Then actually the phlebotomist reaching out, going to for sample collection, taking the sample. So if we compare today, we have much smoother workflows today. If I book an appointment, most of the cases I know that I would have a phlebotomist actually or a collection technician coming to my place at the set time. Once in a while, I do have to call back and remind to change the time, or maybe just to remind that I was expecting him by 8 in the morning, but he has not yet arrived. Or once in a while, I might also call back in to confirm whether it needs fasting or not. So today, with a few providers, I would possibly call up somebody on their direct mobile number, which is certainly not a guarantee that that would get answered every time. Or maybe a few have IVRs as well. But the entire thing must be a complete workflow, which is and the patient should know what is the progress of this entire thing. Mobile apps for real-time booking, for click-to-call. So on a mobile app, the patient can book appointments, seek his clinical history, and then just do a click-to-call and go to the call up the healthcare entity and talk for that particular appointment or that clinical thing. So context also gets passed to the healthcare agent. He would know why is the patient calling in even before the patient tells him. Emails, canned messages, personalized templates, similarly for SMS. Then you could also have voice blast, agentless basically, wherein patients are reminded of their appointments or an upcoming possible appointment that they can book, and the patient can just respond with simple key press or even with speech on whether they need an appointment or what. Then they can be live chat to help patients in real time. It can be supported. Obviously, may not be recommended for emergency services, but for a lot of cases, this is helpful. When we are in office, chat becomes helpful. And then social media. In social media, specifically, WhatsApp is becoming one of the de factos in sending out notifications. So appointment updates, with SMS being flooded with a lot of stuff, WhatsApp is a preferred choice for receiving an update on any possible upcoming appointment. So that can also be done by the systems combined. Yeah.
Perfect, perfect, Prince. I think let me explain, in terms of Lead Squared, what Lead Squared can offer along with Ameyo as the telephony, and overall what is that needed for a patient experience perspective. See, so for all of you out there, on the webinar, right? So the end goal of either doing a digital transformation or, investing something on patient experience, the end result ideally is to one, obviously, the revenue increase or the ratio of appointment versus visitors or visitors versus conversions. That is definitely the end goal where hospitals or healthcare businesses invest. Second is ideally to to cater to the existing crowd or the patients, right, where they already have options available when they search online or any source they search for an inquiry, right? So they are already flooded with empty number of options. Now, how exactly you as a no healthcare provider or a hospital or a clinic, how will you differentiate yourself and reach best among the crowd, right? So the first thing, and which is very important, is the journey of patient experience starts from the inquiry itself, which ideally means either, as Prince mentioned, somebody calls you on a number which is published on your website, or somebody comes through a different channel like Facebook, where you have a Facebook page probably, or Practo, where you are listed on Practo. So it can be any source, but the end goal is how is basically engaged or how is treated in the first couple of minutes of the inquiry. That's where the result in terms of conversion matters, and then the overall journey. So now first let's talk the right experience, how you can provide, right? So first thing, whenever a lead comes in, right? So there are ways where Ameyo can help in terms of automated dialing to the patient, connects automatically to the available agent. That is kind of a call center setup. And you can also have information related to that patient if he is already an inquiry earlier, right? Which is where a platform like Lead Squared, which offers a complete CRM to manage the complete history of the patient. So wherein your telecaller or the call center agent, right, will have a lot of information who before even he talks to the patient, right? That is one. Second is your response times, right? So response times ideally means ki whenever a patient inquires, right, how quickly you're reaching out to him, right? Because the current generation or the the social media and availability of technology everywhere, so they the response time should be much faster, right? If not, you may miss on the leads, right? They may not wait for long, right, until he books the next appointment with some other clinic or a hospital, right? So obviously, yes, again, this depends on the type of healthcare business you're running in or the service you're offering, right? But in general, wherever it is a preventive health check or a health check related to a basic ailment, this definitely works, right? And then the second thing is whenever your call center reach outs, right? So how personalized the communication is and how relevant the communication is, right? So that's where the success of your patient experience starts. And once these are in place, then comes your next important parameter, right? So Shasta, can you go to the next slide? Yeah. So then comes, so one is, yes, your call center is reaching out, giving some information, XYZ, confirming his appointment, right? Now, how system is engaging with the patient, right? Which ideally Prince already covered few points in terms of how personalized the content is. Like I'll give a simple example, like you get a confirmation saying that your appointment is booked, for tomorrow at this time, right? That is a generic SMS. Now, consider other SMS which comes says that hi Murli, your appointment with Dr. XYZ, who is specialized in this, is booked for tomorrow, and here is the link for your clinic location, right? So there's a large difference in terms of how the patient feels, or I mean patient in the sense a customer, right? So how he feels when he receives these two different SMSs, right? That's where the beauty lies, how personalized content can be automated, right? You cannot man people and then send personalized content, right? So that's practically not possible. So you always can use platforms like Lead Squared, where you can automate the overall engagement process. It can be your emails, it can be your SMSs, it can be in your WhatsApp communication if you want to do it. So that can be automated using platforms like Lead Square, right? And personalized content always helps in terms of getting an edge over competition, one. And second, he can become basically let's say for example there are specific ailments where especially if you see a mom and child category of healthcare, right? So there the cycle of a lead or a journey of a lead is more than like 2 years, right? Starting from the first 9 months to the delivery, and then comes your vaccination cycle, etc. So your see in different scenarios the cycles are different, different. Like if you have a specialty clinic, right? It's like a hair clinics or a health skin clinic or any of the specialty clinics. There your frequency is much more, right? A client may be visiting you every 6 months once, or a sitting, or maybe it can be longer. So in all these cases, the engagement matters. So how you engage the customer at different levels, that's where the success of your patient experience lies, right? And you can also have basically relevant communication in terms of anything you do. Like it is like lead nurturing, we call it, right, in a marketing synonym, where you say you engage at specific intervals, you engage at specific events happening, right? So all that can be done using platforms like Lead Square. Yeah. Next slide, please. Shaisa, next slide, please. Yeah. So the other next important parameter where most of the hospitals as of today, in my experience, miss, and where a lot of hospitals are investing currently is the patient experience when he walks in to the clinic, right? So now you have the dialers in place, you have all the calling done, and you have provided beautiful content to the patient. Now the patient finally came to visit the clinic, right? So now how his experience delivered there, right? So that's a huge gap in the current market which we see, where the patient comes in and the front office doesn't even have information of which patients are coming at what time. That we have seen in a lot of scenarios, where a platform like Lead Square integrated with Ameyo will by default can have the list of patients arriving today with their time and schedules. Now whenever he comes to the front office, right? So the front office team can definitely deliver a different set of experience rather than searching for the record and checking whether he's coming, not coming, etc. Right? So that is one. Once that is done, how you engage him in the duration. Like there are a lot of creative ways where I have seen personally in some set of clinics where let's say if it is a kids clinic, they have some set of kinds of games or a set of equipment where they can engage the kids for like that duration of 15-20 minutes of waiting period, right? And there are other set of people where they provide a lot of informative content, right? And they also provide some experience during that 15-20 minute of time, where the patient feels much comfortable in waiting, right? That is second. And third is basically for you, lot of times what happens, doctors usually have doesn't have a predefined schedules, right? Most of them maybe have to go to an emergency where again there is no information provided to the patient that his appointment is rescheduled, cancelled, postponed, or any of these things which are happening. Usually it is, lot of the cases it is manual, where somebody checks that and calls back to the patient. So those cases also can be automated. Prince already explained one point where proactive triggered based calls can happen. Now whenever somebody updates this doctor is not available, system can automatically pick up the list of patients who are scheduled, immediately send a personalized SMS on whatever content you want to design, and automated call can also go to the patient saying that this appointment is rescheduled for this time date, and if you want to accept it, whatever logic you want to design, right? That is the third part of the story. And fourth is, once your consultation is done, definitely yes, your patient record etc needs to be managed. That's where a CRM like Lead Squared will come in, where either you integrate with your systems of your ERPs or your HIS, or Lead Squared also provides some information, or provide some place where you can store the patient records, right? And then comes your feedback collection. So this is again missing in a lot of cases, right? So where the best time or best place to collect the feedback is probably immediately after the consultation, wherein the patient will have ready inputs to share, right? So that is one. But again, so in some cases we have implemented a feedback process or a tablet where they can fill in, at the reception itself they can give the feedback and leave, and whoever misses at that point can be can be tracked by an SMS and an email asking for a feedback, and then probably a couple of times in the next nurturing sequence. So this basically helps you to calculate your net promoter scores, or the overall customer experience in terms of how the customer is feeling. And then you also can have actionable basically based on the feedback, right? So the processes of CRMs is ideally to make sure that whoever gives a negative feedback, so how you help them next time, or how you basically console them in terms of whatever happened, right? So that is where the beauty of automation comes in. A platform like Ameyo or Lead Squared, where you can automate some of these processes and overall provide a better journey for the patient, right? Yeah. Yes, can you go to the next slide, please? And I think Prince already covered some of these points, so quickly to explain. So see, in a hospital scenario, there are different information you already have, right? Let's say, for example, if somebody is coming for a vaccination, you know the cycle of vaccination, that they have to take XYZ vaccinations in the next 1 year duration, right? So systems can basically design and automate some of these reminders and recurring events, right? It can be your next consultation. It can be as simple as the birthday of the patient or the family, whatever you have in the system, right? So a wish can go on that day automatically, or any of these events, right? Let's say, for example, in a classic scenario, a sugar patient comes and he basically have to do a every 30-day checkup or a every 60-day checkup. So system can automatically remind them, right? And in some cases, these reminders can be generic as well, in terms of, let's say, for example, for a pregnant woman, you have a 9-month cycle. Now you want to send relevant content, maybe tips, to eat, what to eat, or what exercises to do in XYZ duration, right? So these look simple at the outset, but when the customer perspective, when he receives it, it definitely adds value in terms of the recall, in terms of creating your brand, and differentiating in terms of how you're different from the existing competitors or existing healthcare providers in the market, right? So again, so to talk about recurring events, it can be many, but as a system, we are capable, or Lead Squared is capable of setting automated reminders, notes, or any other logics to define and send notifications to patient. Yep. Yeah, please. Next slide, please. Yeah, and the next important thing is to run promotions. May not be for all the healthcare providers, but wherever you reach out to people, right? So you have a lot of data in the system. In case if you want to reach out specifically about your services, this works out majorly in specialty clinics, right? If you are running a chain of clinics or a group of clinics where you treat a specific set of specialty segments, can be related to skin, hair, or dental, or maybe any other specific segment. So there you can use Lead Squared as a platform combined with Ameyo, where Prince explained earlier, right? You can do a call blast or an email or SMS blast, right? Or you can, so WhatsApp is currently only for transactional, but in case if you want to promote, you can use the other mediums, like Facebook. You can run campaigns, and all that stuff is possible using the platform, right? And we also provide a trigger based email. So one is bulk SMS, bulk email, etc., which is a promotional content. So the other thing is you can also send trigger based email. So trigger can be anything happening in your CRM, right? Let's say, for example, if somebody's inquired about your service but he never turned up, right? Probably you want to nurture him with different content or a different set of collateral, right? So that is possible using Lead Squared, right? Yeah. Saista, next slide, please. Yeah, so this is basically the integration touch points which we're talking about. So in any healthcare business or hospital, or if any of the health tech businesses, you basically use different sets of platforms, right? Like Ameyo is one platform, Lead Squared is a CRM platform. You will have your HIS, you will have your EMR systems, you have your billing systems. So Lead Squared or any other CRM basically comes in as a integration touchpoint perspective, where all this data can be combined into a single platform to at least provide a one view of the patient, right? In terms of when I want to see a patient history, so now the CRM becomes your central piece of information, where all the data from different systems gets integrated into Lead Squared, and there we provide a view for the whole records in terms of the past history, upcoming events if any, right, and whatever the billing history if you want to check, and all this. And as we already covered, security is again one important aspect. So Lead Squared is already HIPAA compliant, and we also have ISO certification in terms of the platform security, right? So this is where the overall benefit comes into a healthcare scenario. So again, so if you see patient experience or a digital transformation as a journey, it's just not about providing the patient experience in terms of calling, updating status, or doing the regular activities. It's an overall journey for a hospital to make sure that all the systems are in place, right, and all the team is equipped to use these necessary systems and then have consolidated view in terms of analytics, right? And then we also provide APIs basically in a lot of cases where we have seen they want to pull information from Lead Squared or Ameyo and maybe store it in a different place or do some analytics out of analytics tool. Even that is possible using our API. Yeah. So I think we have done, so we basically have the last slide which Prince will explain in terms of how the digital transformation in healthcare is happening currently. Prince, quickly over to you.
Yeah, so this again just reconfirms what we started in this webinar, what we started discussing in this webinar, that most of the consumers prefer a digital way to reach out or interact with the healthcare providers. So this is a 2017 Consumer Health Insight Survey, which was done by McKinsey. And so if people shop for a health plan, it could be again, a package deal, or if they're searching for doctors, if they are looking for their own health information, or for monitoring general health metrics such as BMI, etc., or even for paying insurance bills. So people prefer digital engagement over, dropping in person or any other method. So that is just a reaffirmation of what we already discussed.
Yeah, I think we can take quick question and answers, Sayasta. So we'll be happy to answer any queries, any questions on any of the topics which we discussed. Sayasta, you there?
Thank you, Prince. Thank you, Murli.
Yeah.
Yeah, we will go ahead and take some time for questions now. Just a reminder to all the attendees, please be sure to type your questions into the question box in your control panel. Well, it looks like we have a few questions. So I have a question from Supratik. He says, how will be the health parameters be measured and transmitted to the backend staff? Prince, can you answer this question?
Sure. So the health parameters, would probably be stored in a healthcare system itself. And eventually, when the healthcare provider is interacting with or reviewing a patient's information, so it should be visible within the CRM. Probably Murli can talk more about it, but it can be a small part of it where it can be embedded, or it can be an integration that can be done with Lead Squared and it can be shown.
Yeah, so in ideal scenario, it is mostly integration, Supratik. So it is basically where the information is coming from, right? So if it is a tool like SonoCare or any other system where they can pass information to a CRM like Lead Squared, we by default get that information and show it to the at the patient level, right? So that is possible, right? And then if you are talking about a EMR system where you upload data and system converts it into digital data and then pass it to Lead Squared, that also should work.
Okay. So now we have another question from Ansh, and he says, how can we leverage WhatsApp in improving the patient experience?
Yeah, so Ans, to be very precise, as of today, WhatsApp business allows only transactional content. So if you want to use WhatsApp business, so the best thing probably at this point of in time is to provide transactional content like your appointment confirmations or maybe rescheduled appointments, or it can be anything transactional which you do with a patient can be updated via WhatsApp. And again, especially I recently heard a news where they are still not open to healthcare as a business in providing licenses. So we have to still cross check that.
Okay, so Prince, would you like to add something onto this question?
So I believe Murli has already covered.
Okay, great.
Yeah.
So we have another question. This is from Atul Sharan. He's asking, what kind of personalized care are we talking about in contacting the patient? Okay.
Um, yeah. So again, it's basically it's anything related to engaging the patient with some relevant information which is specific to him, right? So it can be a simple SMS to an email or a call. So whenever these things happen from Lead Squared or Ameyo, right? So we provide personalized content. One, right? Second, we provide information in case if it is a telecaller who is calling. We provide a predefined view of the patient with whatever information which we already have about that patient, right? And if it is a new patient which is coming in, obviously there's no already existing data. So then the process starts from entering data.
Okay.
Ansh, is that, I mean, hope that answers your query.
Yes, I hope Ansh would have received the answer for his question. Now there's one more question from Supratik. He's asking, can other CRM be integrated with Lead Squared?
So Lead Squared itself is a CRM, Supratik. So I mean, we just need to know which is the other CRM which you're talking about and what purpose it is solving. So if Lead Squared can solve that purpose, obviously we will be a replacement. If not, then definitely we are open to integrate.
Okay.
And
So
if it is only if it is about if you're talking about another CRM which is specific to healthcare
Exactly.
information management system or something of that sort, then certainly you would need integration. You can integrate based on the scenarios where it is required. It can either be integrated with Lead Squared, or if it is required for contact center operations, primary need is that, then it can be directly integrated to Ameyo. So what we call as a unified agent desktop, the agent would primarily see information coming in from Lead Square, and we can reserve some space widgets on the same screen to show information from another hospital information system.
okay.
Yeah, and just to add, we by default integrated with some of the major providers like Insta, ERP, or I mean the HS, Live Trends, HS. So integration is definitely possible in the technical perspective. We just need to know the use case, what it is solving, and whether two systems are needed to solve that use case.
Okay. So we have one more question from Supratik. So he's asking, if a doctor gives some medical advice, be it medicine or further tests to be done or even hospitalization, how that will be carried out?
So again, so how the doctor, so if it is manual things, then somebody have to upload that information into the platform, right? And if it is not, if it is already digital, then we need to integrate the digital channel wherever. So there are tools for that again. I mean, Insta, which I was mentioning, right? So they already have a tool basically which is for the prescription platform for the doctors, where they can do it on the notepad or I mean the tablet, and that automatically converts into a digital copy. I mean, to be precise, Lead Square doesn't offer that facility directly in the platform. We just have to integrate in that case.
Now we have another question from Sandeep Mahajan. He is asking, Can this tool, I think he's referring here to the integration, can be used for new customer acquisition?
Yes,
Certainly.
definitely yes. Definitely yes. So new customer acquisition is the place where Ameyo and Lead Square together as a platform will fit in the best, right? So because you will have inquiries coming in from on your phone, or I mean the IVR number, and then you have your telecaller who is calling for new patients and fixing on appointments. So this can be completely mapped using Lead Square and Ameyo.
Okay. So we have another question. This is from Mansi. She's asking, what are the healthcare technology trends that we can look forward to?
So that can be many, right? So I mean, see, digital transformation itself is a trend, which I know Prince mentioned in one of the slides, right? So the digital transformation journey itself is taken by less than 10% of the hospitals as of today in India.
And
Prince can add more as well. Yeah.
yeah, sure, sure. So digital transformation is obviously the umbrella term of all, possibly everything that is going to happen in healthcare in the coming some time. Things like when you go to a hospital and seek an appointment with a doctor. So do you go seek an appointment first on phone or on a mobile app and then go and visit the doctor, or how is it? How do you make your payment? Is all that you would want to see. Comparing a small clinic to a very large hospital, it might happen that your waiting times may change. So as an example, one of the hospitals that we've seen, so not specific to Lead Square or Ameyo, but in general also, if you visit a hospital, how much time would you have to wait, for booking an appointment and then paying the bill, the consultation fees in advance, and then waiting for the doctor. This entire thing would take quite some time, but if it is digitized, you can really scale it up very fast. The advantage of digitizing is obviously improving the patient care, plus also enabling systems like Lead Square or Ameyo to give an even better experience to the patients on reminding them of their appointments, reaching out to them, because the patients can be there anywhere in the hospital. Let's say people usually come to hospitals with multiple agendas in mind. They want to visit a doctor for an appointment for their regular appointment for their kid, or probably they also want to get a diagnostic done. They also want to collect something from the pharmacy and a few reports as well. So they might just go and book an appointment, and then while waiting for the waiting for the doctor to be there, they might just go and do the other stuff. So may not be available at the OPD itself. So it would be great if they receive a call 5 minutes before the doctor is about to be available, and the patient can just simply walk to the right desk. So very small innovations to very large innovations, such as so one of you had asked the question, can it be used for patient reach out? So it would take place. It would certainly be helpful to use systems like Lead Squared, which help you manage your leads here and reach out to them at the right time, in the right priority, with the right agent, and then Ameyo helping you do that, without any effort.
Yeah. So and quickly to add, I think on a personal note, how the industry is going forward. Basically, I have seen a lot of increasing trend on video consultations from the doctors. I mean, at some point, patients doesn't even want to go for the first consultation directly to the clinic, right? So where there are a lot of platforms now available to get the doctor available on a video conferencing platform. They basically share their thoughts at the first, video call probably, and then they come to the clinic. So I mean, the trends are increasing where everything is coming at the doorstep from the patient perspective, starting from their medicines. They can order online, right? Consultation they can do online. So things may go in that direction, but that's again my personal opinion. So yeah.
We have another question from Sandeep. He's asking, when you say 70% of customers choose digital medium for healthcare, what is the action they do, the breakup of action customer takes? Also, do they purchase online or just inquiries?
It can be a combination of all of these, in my perspective. So, right. So one is they basically submit an inquiry digitally, right? So that is one first channel, and they may see your reviews, etc., digitally again before even submitting the form. Once they submit an inquiry, right? So the content they consume is more or less digital, the email, SMS, whatever communication you send, right? And as of today, if you see, there are a lot of cases where hospitals design a mobile app where the patient can see all his information, like classic scenarios like Apollo or Cloud9 or any other bigger hospitals in the market. So they provide basically a portal or a digital sign-in where once you sign in, you see all your family health records, right? So it's just not a single platform. When I say digital, it is more of a combination of different platforms. It's including CRM, your telephony, your ERP, and the customer perspective, that is the patient perspective. He will have a single place or a better view digitally in terms of what is the total overall status, right? And what is the previous health record what he has, and this will become much more advanced going forward, because if you want to share this information to anybody, the next consultation, maybe we can enable that with a click of a button, right? So ideally the overall goal is the things are moving digital from the regular practices of what used to happen maybe 10 years back. The things are changing into more of a digital world.
Okay. So we have few more minutes left for 4 o'clock. So here's the one more question.
Yeah, I think last one question I think.
Yeah.
Yeah.
So this is, what about using
Yeah.
Ameyo and Lead Squared integration for emergency services? Can we have impact on there?
Certainly.
I'll let Prince handle that. Yeah.
Yeah, certainly, yes. So Ameyo is already being used for emergency services. Ameyo and Lead Squad are together being used in healthcare services otherwise also. So in emergency services, what a healthcare provider needs to ensure is that the calls are usually it would be a voice call, so calls are answered on the right time, and the system can simply not go down. So, a high availability system is what is needed. LeadSquared, Ameyo together, provide that as an integration with the correct routing to the agents. It also ensures that any calls that are coming in are answered at the right time. Additionally, Ameyo also provides a way to, allow a pick call sort of facility. So if or a peak facility, what you can say. The agents are also notified of waiting calls in queue. So the agents who are already attending emergency calls can, speed up their handling of that call and handle any pending waiting calls, if at all, in the queue. So this is something that can certainly be done.
Great. Thanks, Prince. It looks like we have covered all of our questions. Murli and Prince, is there anything else you wanted to cover before a wrap up?
No, I think I'm good. I think thanks. Yeah.
Yeah, we certainly like the questions that were asked.
Yeah.
Thank you for everybody for this participation.
Yeah.
Great.
Yeah. Thanks everyone. Thanks for joining the session.
Well, great. Thank you, everyone. We appreciate you being here. Thanks again for joining us today, and we will see you all again in November with our another webinar. Hope you all had a great session. Have a great evening. Thank you. Thank you all.
Yeah.